Waiting on the line right now is Dr. Al Johnson. I'm hearing stuff about this flu shot, Al, that does not seem like this thing is going to be overly effective.
Well, it is effective. It's just a different strain that is going around.
Okay. So you're meaning the different strain that is going around will not the vaccine will not affect that, will not prevent that strain.
Yeah, it's not exactly. It's not in the vaccine. However, the vaccine does give you resistance to the three that are in there, which is the same three as last year.
Yeah,
and it does kind of stimulate your immune system to maybe calm down the effect of this year's strain. So it is important to get the vaccine.
So if you haven't gotten the vaccine as of yet, is it still okay to get it now?
It is, yes.
And then tell us about this other strain of the flu. What are the symptoms? How is this one different than the other three that the vaccine covers?
Well, it's also a type A flu. There's two type A's in this year's vaccine, which is the H1N1, which was the swine flu in 2009. Yeah. And then there's the H3N2, which is a Texas type A, and then there's a B. The one that's going around is a little different. You get chills and fever and fatigue and aching, and then it can turn into respiratory problems. So the message is, if you're starting to come down with it, see your doctor. You can get a prescription for the anti-flu medicine, Tamiflu or Relenza, that can help mitigate the symptoms.
Yeah.
And if you're having respiratory symptoms, cough, sinus drainage, continuous fever, you may have a secondary bacterial infection which needs an antibiotic.
Can you, this is a little bit off topic, but how did we go from, and this you really wonder about how much politics and the media plays in the fears that we have in this country. But how are we not talking about Ebola right now? It looked like the Armageddon. The world was coming to an end. Everything was about Ebola. The election came, and now you don't hear about it anymore.
Well, it's not on our soil right now.
Right.
And so that makes a big difference. They do have screening in place, and that helps also to calm everybody down.
Yeah.
To make sure people are on top of the situation. I'm in Dallas, and of course, we had the first case here.
Yeah.
They have set up here in Dallas a freestanding center that anybody that has symptoms can go to. They have isolation places there so that it's not a regular hospital where other people would get exposed, or an emergency room where other people could get exposed. So they're doing the right things.
Yeah.
And they have the right things set up.
But it is, luckily CNN has found other things to focus on as opposed to 24-hour coverage of Ebola. But imagine if this Ebola outbreak, that whether it was, as severe as it was being projected in the media, with that Ebola outbreak, it happened at the same time that the flu season peaked. A lot of people would have, do you have the flu or is it Ebola? I mean, we really dodged a big scare there, don't you think?
Oh, yes. And we've got a better handle on what is really going on. The acute care physicians are aware of what to look for, how to get it tested, and what to do. So all those things really help calm down the fear and make sure that the medical community is on top of the situation, whether it's flu or whether it's some other condition.
So despite what you're hearing out there, still get out there and get that flu shot. Really important to do right now.
Yes, exactly, because a lot of times the Christmas season, people are gathered more, big crowds. So if you're out, wash your hands frequently. Don't touch your face and nose and so forth. If you have the flu, wear a mask so you don't spread it, even at home. And then wash your sheets and your clothing frequently so you don't spread it.
All right. Dr. Al Johnson, thanks for your time this morning.
You're welcome.
All right. Christine has news in 2 minutes on WIBX.